Ever wondered why mefenamic acid is often the go-to choice for pain relief? It's a question that many of us don't think about. We just reach for the medicine cabinet when a headache strikes, or when muscle pain decides to make an unwelcome visit. But have you ever stopped to consider why this particular drug is so prevalent in pain management? In a world brimming with painkillers, why is it that mefenamic acid often stands out? What makes it different from ibuprofen or paracetamol? Is it just a matter of preference, or is there more to this story? These are the intriguing questions that surround mefenamic acid, a drug that many of us use without a second thought. Understanding the answers to these questions not only expands our knowledge but also helps us make more informed decisions about our health. So, let's get curious. Stick around as we delve into the world of mefenamic acid, a common yet intriguing painkiller. Mefenamic acid, a name we often hear, but what exactly is it? Let's delve into the world of pharmaceuticals to unravel the mystery behind this common medication. Mefenamic acid is a member of a broad family of drugs known as non-steroidal anti-inflammatory drugs, or NSAIDs for short. Now, these NSAIDs are a class of their own, distinct from steroids, and they have a wide range of applications in the medical field. So, what makes mefenamic acid unique? Well, it's primarily used to alleviate pain, reduce inflammation, and lower high temperatures. It's a versatile tool in a doctor's arsenal, able to combat a variety of discomforts and ailments. One of the most common uses of mefenamic acid is to ease the pain caused by arthritis. Arthritis, as some of you may know, is a condition characterized by inflammation of the joints, causing pain and stiffness that can worsen with age. By reducing this inflammation, mefenamic acid aids in providing relief to those suffering from this ailment. But that's not all. Mefenamic acid also plays a significant role in managing menstrual pain. For many, the monthly cycle can bring about discomfort, or in some cases, debilitating pain. Here, mefenamic acid steps in as a knight in shining armor, providing much-needed relief and making the process more manageable. In addition to these, mefenamic acid is also used for other medical conditions, where inflammation or pain is a problem. Its wide-ranging application makes it a staple in many medicine cabinets worldwide. However, it's important to remember that, like any medication, mefenamic acid should be used under the guidance of a healthcare professional. Every drug has its potential side effects and interactions, and it's crucial to be aware of these before starting any new medication. In essence, mefenamic acid is a powerful tool in combating various types of pain. It's a testament to the wonders of medical science, providing relief to millions and improving quality of life. So, the next time you hear the name mefenamic acid, you'll know exactly what it is and what it does. Now that we know what mefenamic acid is, it's crucial to understand how it works. Like a detective, let's delve into the intricacies of this medicine and uncover its mechanism of action. Mefenamic acid belongs to a class of drugs known as non-steroidal anti-inflammatory drugs, or NSAIDs. But what does this mean? Let's break it down. Our bodies are complex systems, and when something is amiss, like an injury or infection, our body responds by producing substances called prostaglandins. These little molecules are like the body's alarm system, causing inflammation and pain to alert us that something is wrong. Now here's where mefenamic acid steps in. It's like a superhero in a cape, swooping down to save the day. Mefenamic acid works by blocking an enzyme in our body known as cyclooxygenase, often shortened to COX. This enzyme plays a crucial role in the production of prostaglandins. By blocking COX, mefenamic acid effectively turns off the alarm system. It halts the production of prostaglandins, thereby reducing inflammation and consequently pain. It's like unplugging a loudspeaker that's blaring out a siren. The source of the noise is cut off, and all becomes quiet. Now, it's important to remember that mefenamic acid doesn't cure the underlying problem causing the pain or inflammation. It merely helps manage the symptoms, giving your body a chance to heal, or for other treatments to work. Furthermore, while we focused on pain and inflammation, it's worth noting that prostaglandins perform other functions too, like regulating body temperature and protecting the stomach lining. So, when mefenamic acid inhibits their production, it can also impact these other functions, which may lead to side effects. But we'll delve into that later. So it's not magic, but a complex process that allows mefenamic acid to alleviate our pain. It's like a key, perfectly designed to fit into a lock, turning off the alarm and restoring peace to our bodies. Like any medication, mefenamic acid comes with its precautions and side effects. We've all experienced it at some point or another. You're handed a prescription, and the sheer list of potential side effects is enough to make your head spin. You might be wondering, is this going to help me or make me feel worse? But don't panic just yet. The key to understanding and managing these side effects lies in being well-informed and under the watchful eye of your healthcare provider. Let's delve into some of the common side effects of mefenamic acid. Stomach upset, for instance, is a frequent visitor. It's like that uninvited guest who shows up at your dinner party, unannounced, causing a bit of a ruckus. But fret not, because this can be managed by taking the medication with food or milk. Next up, we have nausea. It's like that queasy feeling you get when you're on a roller coaster ride. This can be a bit tricky to handle, but small, frequent meals or sucking on hard candy can offer some relief. Then we have dizziness, which can make you feel like you're in a spinning room. It's important to move slowly, especially when getting up from a sitting or lying position, to prevent this feeling. But remember, these side effects are not set in stone. They may not occur at all, or they might show up in a different guise. It's a bit like a game of chance, with the odds varying from person to person, and that's where medical supervision comes in. It's like having a seasoned guide when you're navigating unfamiliar terrain. Your healthcare provider can help manage these side effects, adjust your medication if necessary, and ensure that the benefits of taking mefenamic acid outweigh the potential risks. So don't let the fear of side effects deter you from taking necessary medication. Like a well-prepared explorer, arm yourself with knowledge and trust in your guide, your healthcare provider. Remember, knowledge of these side effects is not to scare you, but to equip you with the information needed to make informed health decisions. Let's revisit the main points about mefenamic acid we've explored today. We dove deep into the world of this common painkiller, uncovering its uses, how it works, and the precautions one should take while using it. We started by understanding what mefenamic acid is. It's a member of the phenamate group of nonsteroidal anti-inflammatory drugs, often referred to as NSAIDs. It's commonly used to alleviate pain and reduce inflammation from various conditions. This might include menstrual pain, dental pain, and even migraines. It's also used to treat arthritis, both osteoarthritis and rheumatoid arthritis. We then explored how mefenamic acid works. It operates by reducing the production of prostaglandins, substances in the body that cause inflammation, pain, and fever. Mefenamic acid inhibits the enzyme that makes prostaglandins, resulting in lower concentrations of these substances and thus less inflammation, fever, and pain. Next, we delved into the potential side effects of mefenamic acid. Like all medication, it's not without its risks. Some of the common side effects may include stomach upset, nausea, or dizziness. It's essential to consult with a healthcare professional if these persist or worsen. Rarer, more serious side effects could include easy bruising or bleeding, persistent sore throat, sudden weight gain, or signs of kidney problems. We cannot stress enough the importance of immediate medical attention if any of these occur. Moreover, we touched upon the precautions one should take. It's key to disclose any allergies, medical history, especially of asthma, blood disorders, liver disease, heart disease, stroke, or high blood pressure. It's also worth noting that alcohol and tobacco can increase stomach bleeding risk, so it's best to limit their use. Bringing all these points together, we see the importance of understanding common medications like mefenamic acid. As we navigate through life, we're bound to encounter various health challenges, and having knowledge about common medications empowers us to make informed health decisions. Whether it's for ourselves, our loved ones, or our patients if we're in the medical field, this knowledge can be crucial. So, whether you're a medical student, a curious individual, or someone who uses mefenamic acid, this knowledge is designed to help you understand better what you're dealing with, how it works, and what to watch out for. Knowledge is power, and in this case, it's the power to ensure better, safer health decisions. And there we have it, a deeper understanding of the common painkiller, mefenamic acid. Thanks for joining us on this enlightening journey, and remember, stay informed, stay healthy,